right, so I'll go back to the Infliximab IV. And we were going to do an adult with an 80 weight of 80 kilograms. And so their typical dose for 5 mg per kg for that patient then would be 400 milligrams. Dose is typically given every 8 weeks. But suppose we see a very low trough of 2, and we want to go up to 10, which is usually a good value. We hit the calculate button. All right, so here we get the individualized nomogram. This gray shaded area that you see is actually the half-life that's on the label, and you can see that this patient is pretty close to that value. But if you're trying to use a 5 milligram per kilogram dose, you aren't going to be able to dose every 8 weeks. You'll have to dose closer to every 4 weeks. And you can see that at all of these doses, we go to 7.5 milligrams, 10 milligrams per kilogram, and even up to 15. You still cannot get to that 8-week interval. And then in order to see what the concentration time profiles look like, we run simulations of that dose. And you can see that if you're trying to get to 10, you'll get there very quickly as is typical with an IV. And you can do this with all 4 doses. We also provide probability charts, and these are really more sort of an information. In other words, this patient has about a 51% probability of developing anti-drug antibodies. So they're not low risk, they're not high risk, but they're still sort of in the middle group, but nonetheless have a risk of developing anti-drug antibodies. They also have, as a consequence of their high clearance or short effective half-life, a rather poor probability of getting into complete remission with mucosal healing. And the same thing, about a 50% probability of having a CRP normalization. So this is a patient that may need some attention.